Hey, I am Divyah from Group 25. Today I will be talking about mental health changes, mental issues changes that should be reported to the headness. So let's start with mental health. So to better understand mental illness, you should always encompass the concept of mental health. So mental health, to simply put it in layman term, is the absence of mental illness. So once the main quality of mental health is actually the state of emotional balance. If this emotional balance is disrupted by any other like stress, some kind of factors, then yes, mental issues may arise, and this type of changes should be observed and immediately reported to the headness. Let's talk about stress. Earlier I've stated about stress. So stress which results in any changes from the normal routine. For example, when a patient finds out that he has these issues, or a patient finds out that there are medical bills that he needs to pay. So all this kind of small things, although it seems insignificant, it may contribute to stress. And these changes, they are physical, such as their illness, such as their disability. It causes physical stress, and life events also causes physical stress and mental stress. So all of this issue affects the person's ability to maintain a state of balance that I said earlier. So these are all main causes of disruption, because the society, our own fear, our own anxiety, all this will cause mental issues. There are different types of mental illness that we need to know, we need to address. So first is anxiety disorder. So anxiety disorder basically is like panic, it's like obsessive compulsive disorder, OCD, like we are only one thing, that kind of thing. And then there are phobias. Phobias are under anxiety disorder. So when it comes to the next type, which is PTSD, post-traumatic stress disorder. So this type of disorder, usually after a traumatic event, it's in the name itself, so we have to address that too. There is also depression when it comes to chemical imbalance in the brain, low self-esteem, poor coping skill. All this can lead to depression. Hormonal changes can lead to depression. And then there is the bipolar disorder, which is manic depression. And also there is schizophrenia. Of course, like I said, substance abuse disorder. There is something called substance abuse disorder. Any patients who are now on their road to recovery, on their road to becoming sober. So there is also disorder when it comes to substance abuse. As I said earlier, schizophrenia. So yes, all these are types of mental illness. So if any patient have any background of any type of this illness, of course we have to look out for mental health, mental illness issues that we need to immediately report to headness. So let's get started with what are the signs. So what are the signs and symptoms? So I will not be demonstrating with the patient, I will demonstrating it on myself. What you should look out when it comes to patients that may have mental changes mental status changes, that you need to report to the nurse immediately. So first, let's start with body tremors. So when a person is extremely scared and extremely timid, so body tremors, something like this, or shivering in their body, they may have that. And also mood changes. So one day they may be happy, the next day they may be sitting down sad, and then the next thing they may be angry and they just feel frustrated. So that is one of the things. Number 3, they may have anxiety, fear. So anxiety and fear you can see when a person feels as if everything is caving in. So when they say their chest is tight and they feel like everything is caving in, so that is usually a sign of anxiety. Next, we have to look out for his hallucination. So hallucination, as I written down here, crawling on skin, a feeling of. So if you see a patient doing this kind of, like they feel like something's crawling and all that, and they tell you that they see something, do not always like think that they are just like playing around or something like that. Always report. All these are signs and symptoms that we should report and should not look down. All these are important, are significant signs and symptoms that the patient may be going through a mental status change. So when a person is feeling you know, they keep doing this and they keep doing like this, and also they like look up, look and say, they say that they see some things. All these are signs of hallucination. Next is heart palpitation, rapid pulse rate, insomnia, nausea, vomiting. All these are signs and symptoms that we gotta look into. And also delirium as in sometimes they may suddenly shout, like they just go haywire. So that is their breaking point. And usually when you see this, immediately report to the nurse. And also when a person is having seizures, you know, when they're just having seizures, when they couldn't control themselves, they are holding their chest, they are having chest palpitation, they say their chest feels like it's heavy and it feels like it's beating very fast. So all these are signs that we shouldn't look down onto. So we should report all these signs to the nurse. And I think that's it for today. Thank you very much for enjoying this video.